and welcome to ERNs on Air, the quarterly bonus series of the EURORDIS Rare on Air podcast. I am your host, Julien Poulain. In this episode, Nora Lazaro, our ERN and Patient Engagement Manager, speaks with Lori Renna Linton, a patient representative, and Sophie Ripp, a project manager, both from ERN RND, the European Reference Network for Rare Neurological Diseases. Nora, Lori, and Sophie discuss how patient representatives from ERN RND have developed a series of patient journeys for several rare conditions and how they are using them. A patient journey refers to the comprehensive path that a patient with a rare or complex disease should follow from symptom onset through diagnosis, treatment, and follow-up, with the aim being to optimize the entire healthcare experience and improve outcomes for the patient. Nora's guests discuss their experiences and highlight the benefits and importance of patient journeys for the rare disease community.
Hi, Nora. Thanks for inviting us.
Hi, thank you.
Thank you so much for being here with us today. So let's get started. Lori, I will start with you. You are a patient representative in ERN RND representing hereditary spastic paraplegia, which acronym is HSP. Could you please tell us how you got involved in this network?
Yeah, sure. In 2017, I received an email from, hopefully I'm pronouncing this correctly, from Virginie Ross-Fazer, who is now the CEO of EURORDIS, asking if I would like to join the ePAG in the ERN RND. I needed to supply a CV and a letter of recommendation from EuroHSP, who I was representing. The current group of patient advocates then had to discuss and decide if I should join them. I am happy to report that they said yes. And now, 7 years later, I'm the coordinator of our group, which is an awesome group of patient advocates, by the way.
That's a great summary of your past 7 years. Thank you so much for sharing it with us. Today's episode focuses on patient journeys in the ERN RND. And many ERNs patient groups have developed their own patient journeys now. Could you please explain to our audience in your own words, what is a patient journey?
Yeah, it is a document that legitimizes what you have, that it's not just a made-up fairy tale disease. It is also a document that cuts to the chase and gives context. And when I say document, you can go to the ERN RND website, and in the header under disease knowledge, you find which disease you want the patient journey for. Scroll down to find the patient journey. In the case of HSP, the document has been translated to 11 languages and more are coming. Click on the language you need. You will see an infographic and a table. You can download either. I'm referring to the infographic. It's organized into 4 rows and 4 columns. I hope that gives a visual. Now, let me give you an example. Next week, I have an appointment with the doctor about my back. He has likely never heard of hereditary spastic paraplegia, HSP. I'll bring him the patient journey infographic translated to German so that he can quickly understand why it is that I'm in a wheelchair. I will point specifically to the first row, second column in the infographic, diagnosis of the disease. It lists a variety of possible symptoms. Then in the first row, third column, treatment of the disease, it explains that HSP is progressive and there is a day-to-day variation in the effective symptoms. I will also point to the third row, third column, challenges of treatment, where it explains that there is no cure for HSP. Now that he has context, I can explain the reason why I'm in his office and his job of diagnosing my issue might be easier.
Thanks, Lori, for explaining to us specifically in real life how a patient journey can help you. And Sophie, what are the benefits of having a patient journeys for rare decisions? We saw one that Lori just explained. Can you maybe elaborate further on this?
Yes, of course. So I think patient journeys are specifically important for rare conditions because they're more than 5,000 different rare diseases. So most likely your general practitioner will not know your condition. Not only your general practitioner, but also your friends or your employers. So this document, if you have this document with you, you can really show them what you have. And as Lori said, that it's a legitimate disease. It's not something you made up. And you as a patient, for rare diseases, often you are the expert of your disease. So you can really, with this document, explain the challenges of your life. And it's kind of a testimony that the condition you have is real and that it has to be taken seriously, even though the person you're talking to doesn't know the disease.
And I was thinking that maybe they can serve as service improvement tools as well, because they identify the needs of the patients with a certain condition, and this can always then feed back maybe to clinical practice guidelines or patient pathways, so that there is a constant communication also between the patient needs and the guides for the actual clinicians as well.
Mm-hmm. Yeah, I think that's also important to say that it's a way also to show doctors what the patients need. And it can also go further into like the more political sphere where patients with rare conditions need support also from their government. And this can be seen in the patient journey.
Lori, back to you. Could you please explain to us your actual experience of creating a patient journey? And maybe you can also let us know, how did you engage with your community to create a patient journey for HSP?
Sure. Well, the patient journey for HSP was mainly created by Adam Lawrence, who is he's in the UK support group for HSP. Mm-hmm. He conducts a survey every year and has been doing so for the past 10 years. And so it is a synthesis of the responses collected over 10 years that makes up the patient journey. And once that was put together in a working form, we spent several months tweaking it. And of course, a clinician has to approve information that is in the medical portion of the patient journey. And possibly, Sophie, could you explain a little bit more about that?
Yes. So how it works is that the patients or the patient representatives really take the initiative of creating a patient journey. And so via a survey, they ask patients their unmet needs and their challenges and their goals. And then they turn it into a patient journey and reviewed by a clinician just to make sure that it's medically correct. And then some infographics are added to the document to make it more easily understandable.
Sophie, you are the network's project manager. Together with the patient representatives, your role is key to disseminate the patient journeys as well as supporting their implementation. So could you please explain to us what actions have you taken to put the patient journey into action, let's say in action?
Yes. So first, once the patient journeys are finalized, we make them available on our ERN RND website, and we disseminate via our social media channels. And we recently agreed with the ERN RND clinicians to hand out these patient journeys to every newly diagnosed patient. We also want to print flyers of the patient journeys and send them to the expert center so they can hand them out. We also agreed with patient organizations within Europe to disseminate the patient journeys. And we also recently turned a patient journey into scientific theater. So a professional actress actually played the different steps of the journey that the patient is going through, and that she did it for dystonia. And that was played at the European Academy of Neurology Congress in front of thousands of neurologists. And she also made a similar scientific theater it's a discussion between a dystonia patient and the sister of a Huntington's disease patient. And that really, it's a very touching way of presenting a patient journey because it feels really real. And the last point I wanted to make is that we also recently we asked our patient representatives to advertise their patient journey of their own disease in a 1-minute pitch, explaining how the patient journey was very useful and essential in a specific situation. For example, when talking to their employers or when talking to their insurance company.
I think it's very interesting, the proactive approach you have in disseminating the patient journeys, which we always say that doing a patient journey or developing a patient journey, it's not only about the end product, but also the process till you arrive to that end product. And then actually what you just describe, which is yes, once you have that deliverable, let's say that it's something that you can touch, how you can actually disseminate it in a way that people can benefit from it. Patient representatives, newly diagnosed, also clinicians. So thank you so much for sharing your ideas and experiences. Hopefully they will inspire others to take some action as well on their own patient journeys. I will also put down in the description of the video the links to the resources you have mentioned so that people listening can have a look to them. Maybe one last question about the dissemination of the patient journeys. Have you developed any specific action to target health professionals and general practitioners in Eastern European countries?
Yes, so we have a very systematic approach to translate our patient journeys into many different languages, and including Ukrainian and Russian and Bulgarian. So the way we do it is we automatically translate the patient journey we have using AI, so for example, DeepL, and then this automated translation is reviewed by a patient that is a native speaker of the language, for example, Ukrainian or Russian. And we'd also ask native speaker clinician to review the translation, and then we can publish the translated patient journey on our website and disseminate it.
Actually, it's impressive the work you've done in translations, because there are translations to many languages for each of the patient journeys that you have developed within the networks. It's impressive.
Mm-hmm. But I think it's really important because patient journeys are really, the target audience is people who don't necessarily speak English. So if the document is only in English, the reach isn't that good. So it's really important to have it in the different languages.
So we will wrap up now. Maybe to finalize, Lori, do you have any advice for the patient representatives that are maybe thinking of embarking on the development of a patient journey for their own conditions in the ERN?
I mean, I definitely do have some advice, but before that, I'm not sure if this completely fits here, but I need to do a little shout out because our patient advocates, our ePAG would not work if it, I'm sorry, Sophie, but I need to say this, you are so awesome. And it would not work without you and without Katerina. It would not work. Definitely not. So I'm not sure if that completely fits there, but I needed to say that. And
thank you, Lori.
You're welcome. And any advice? Yeah. I mean, it's like the patient journey is something concrete. It's something that patients can use. They can go, they can download it. That it's something concrete that they can take to their doctor and they can use it right then. So for sure, in terms of advice, I would say do it. Definitely do it.
Thanks, Lori. And thank you also for acknowledging that the support from the ERN coordination team, it's actually very key, particularly in disseminating the patient journeys, because
it really is.
You really need a collaboration between the patient advocates and then the coordination team from the ERN. In this case, we have Sophie, we have Katerina as well. And I think it's very important to mention it. Thank you for that.
Yeah, I think it's also the main roles of the ERNs is to really, it's about care of patients. So the patient journeys are really a good, essential activity of the network.
And Sophie, maybe one last thought about any advice on how to best communicate about patient journeys outside the ERN to reach out non-experts?
I guess, to reach out non-experts is really to disseminate the document. So as Lori said, just download it and bring it to your doctor and disseminate via social media, of course, and use the translated version of it.
So thank you so much, Lori and Sophie, for being here with us today. It was a real pleasure listening how you have worked on developing several patient journeys and how you have put in action what actually the patient journeys are made for, which is, as you both mentioned, improving the quality life of people living with a rare disease and also improving the healthcare services. So that's all for today. Do you have any last thoughts that you want to share with the audience?
I just wanted to say thank you. And I think just this podcast is also a way to advertise the patient journey. So that's really nice.
I wanted to say thank you also, and I'll agree with Sophie for sure.
Thank you.